Amphetamine and amphetamine-like drugs have different structures but similar mechanisms of action. They both stimulate a sympathetic nervous system, or fight-or-flight response, in the peripheral and central nervous system. This makes them central nervous system stimulants. They both trigger the sympathetic response by indirectly raising levels of dopamine and norepinephrine in the synaptic cleft, or the space between neighboring neurons, or a neuron in its target tissue. Both amphetamine and amphetamine-like drugs inhibit the reabsorption of dopamine and norepinephrine back into the presynaptic neuron from the synaptic cleft. Amphetamine additionally increases the release of stored dopamine and norepinephrine from the presynaptic neuron into the synaptic cleft. In the peripheral nervous system, norepinephrine in the synaptic cleft acts on the adrenergic system. Norepinephrine binds to and stimulates alpha and beta adrenergic receptors. The most noteworthy effects are alpha-1 receptor stimulation, causing vasoconstriction, and beta-1 receptor stimulation, causing a positive inotropic and chronotropic effect, meaning the heart's force of contraction and rate increase. Both of these lead to an increase in blood pressure. Due to this action on the adrenergic system, amphetamine and amphetamine-like drugs are considered indirect adrenergic agonists. In the central nervous system, the increase of dopamine and norepinephrine leads to overall central nervous system excitation, resulting in increased alertness, reduced fatigue, improved mood, and suppressed appetite. Amphetamine medications include amphetamine, amphetamine mixtures, dextroamphetamine, and lisdexamfetamine, while amphetamine-like drugs consist of methylphenidate and dexmethylphenidate. Amphetamine and amphetamine-like drugs are mainly used for their central nervous system effects to treat attention deficit hyperactive disorder, or ADHD, and narcolepsy. Amphetamines may additionally be used to treat obesity. Adverse effects of amphetamine and amphetamine-like drugs include arrhythmias such as tachycardia, hypertension, chest pain or discomfort, nausea and vomiting, diarrhea, dizziness, anxiety, irritability, tremors, weight loss, and insomnia. Amphetamine and amphetamine-like drugs should not be used with hyperthyroidism, glaucoma, history of drug abuse, suicidal tendencies, and within 14 days of an MAO inhibitor, and they should be used cautiously with cardiovascular disease, hypertension, and seizure disorders. When receiving treatment with amphetamine and amphetamine-like medications, it is essential to monitor blood pressure, pulse, weight, circulation to extremities, and behavior to assess the risk for abuse. For ADHD, attention span and impulse control should also be monitored. And for narcolepsy, narcoleptic episodes should additionally be monitored. If indicated, such as for those with a history of cardiac disease, an ECG and echocardiogram may also be necessary. To prevent insomnia, the medication should be taken in the morning. Amphetamine and amphetamine-like drugs have a significant potential for abuse due to their ability to cause a euphoric high or extreme mood elevation. As a result, they are Schedule II controlled substances, and when prescribed, the potential benefits are weighed against the potential for abuse. Prolonged use of amphetamine and amphetamine-like drugs can result in dependence and tolerance. Dependence occurs when the body adjusts to the drug, resulting in physical and psychological reliance. Stopping the drug can lead to withdrawal symptoms, including fatigue, depression, sleep problems, and a strong urge to continue using the drug. Tolerance, however, involves needing higher doses to achieve the same effects. Dependence and tolerance can lead to increased drug use, raising the risk of toxicity and overdose. To counteract this, a healthcare provider may recommend taking periodic breaks from the medication. Toxicity and overdose result from overstimulation and manifest with the previously mentioned adverse effects, as well as seizures, psychosis resembling schizophrenia, hyperthermia, and rhabdomyolysis. Treatment for toxicity and overdose involves supportive care, such as activated charcoal to reduce drug absorption if taken recently, antipsychotics such as haloperidol for psychosis, benzodiazepines such as diazepam or lorazepam for agitation, anxiety, and seizures, alpha and beta blockers for managing blood pressure and tachycardia, and measures to lower body temperature in the case of hyperthermia. I hope you found this video helpful. If you did, please let me know by giving it a thumbs up, subscribing, and leaving a comment below. Thank you, and bye!